Good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Thursday, November 30th, 2023. And our top story today, oral hygiene is crucial for overall health. Joining me now to discuss this and a lot more, Dr. Frank Scannapieco is the chair of oral biology at the University of Buffalo School of Dental Medicine. Frank, it's great to see you. Thanks so much for joining us on the program this morning.
Good morning.
Well, we're going to talk a little bit this morning about oral health. And Frank, oral health, really, it's a gateway to everything in our body. Oral health is crucial for overall health.
It seems that over the last 20 or 30 years, there has been increasing evidence that a lot of common chronic medical conditions are influenced by, the status of oral health. And I've been involved quite a bit in this. And the evidence is growing. And I think there needs to be more attention paid to oral health in order to prevent other conditions.
And when we're talking about other conditions, could be things like heart disease, maybe some oral cancers or cancers, right? I mean, there are a lot of really significant diseases that if you don't, and we'll talk about in the second segment about what you should do, just to remind everybody, but if you don't do those important oral hygiene steps, you could actually get one of these more serious diseases.
Right. The mouth is filled with bacteria that stick to the teeth and that causes a variety of reactions, including inflammation of the gums and dental decay, of course. But it also, the bacteria can also get into the body. If this happens chronically over time, it serves as a risk factor and promotes inflammation in the body as well. So it's not unlike other risk factors that leads toward diseases. So I think the more attention we pay to keeping a clean mouth, the more healthy we're going to be.
Yeah, and we're not referring to what you're actually saying, because a lot of people have poor language hygiene sometimes, but we're talking about actually in all seriousness, cleaning your mouth. Frank, in terms of, let's talk a little bit about visitations. And I do want to spend the bulk of our time in the second segment talking about the steps you take, but it really is important to evaluate with a practitioner at least every 6 months. And a lot of insurances, whether through your employer or individually, are available that cover these typical visits.
Yes, I think the frequency of going to the dentist varies between people. Some people with high risk would go more often, and people with less risk less often. At least once or twice a year, going in and getting an examination and a cleaning, I think is prudent. And I would encourage that, for everyone.
And Frank, you were talking about inflammation. Is that what oftentimes is referred to as periodontal disease? So the inflammation that you're talking about, it would be referred by your clinician, your dentist, as periodontal disease. What exactly is that disease?
Yeah, inflammation is a biological process that our body uses to fight off infection. So a form of inflammation in the mouth is periodontal disease. Most of us have some form of inflammation in our gums, either gingivitis or, which you might notice, your gums might look red. When you brush your teeth, you might notice blood when you spit out. Those are signs of inflammation. And then, of course, if this gingivitis is not treated and reduced, then there's a possibility of having more serious problems like bone loss around teeth, which then leads to, of course, loose teeth and tooth loss.
Yeah.
So it's a continuum of a biological process.
Yeah. Sorry, Frank, I didn't mean to interrupt you. I just want to take a very quick break. When we come back, we'll talk more about your oral hygiene and your overall health. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network. Welcome back. We're joined this morning by Dr. Frank Scannapieco of the University of Buffalo School of Dental Medicine. Frank, thanks so much for staying with us. Really appreciate you hanging around for segment number 2 this morning.
Great to be here.
Yeah, it's always a fun conversation. I flossed in between segments. Frank, let's talk about, we mentioned some of the major diseases, talked about heart health, but you actually focused on some of the respiratory challenges. So there are respiratory issues. It's not just some of these other systemic issues. There are respiratory issues that you could have as a result of poor oral health.
Well, the mouth, of course, is connected to your lungs. When we breathe, the air goes through our mouth into our lungs. And that makes a direct passageway for bacteria in the mouth to enter into the lung. So there's been some evidence showing that poor oral health leads to increasing numbers of bacteria in the mouth. Those can be aspirated. And this is especially important for older people. As we get older, we tend to have less control of our swallowing. And that leads to more frequent periods of aspiration, which then could allow bacteria to get into the lower airway to cause serious diseases like pneumonia. Another important disease that might be affected is chronic obstructive pulmonary disease, which has been most associated with smoking. But there's some evidence that having poor oral health, periodontal disease might influence that and make it worse.
Frank, do we see a decline in oral health and oral hygiene during and post-pandemic? I mean, I brush my teeth. I remember to brush my teeth at least 2 times a day and floss once a day. But did we see adults, children, maybe put that aside, as icky as that sounds?
Yeah, I don't know. I'm not familiar with evidence like that. I do know there has been some interest in the possibility that people who have poor oral health and inflammation in their mouth might be more susceptible to COVID. So there's been quite a bit of studies that have shown that people who were COVID, especially hospitalized and had serious trouble, tended to have more periodontal disease. So I think, again, there's so many connections here we can make, trying to drive home the point that it's important to, pay attention to your oral health. And, it need not be an onerous thing. I think a few minutes twice a day goes a long way, I think, to help prevent these problems.
Yeah, and let's talk about that. Let's finish the segment on that. We talked a little bit about going to the dentist, and again, a lot of insurance covers that, and you can either get it through your employer or you can buy it separately, individually. And it's not, I buy it individually, it's not too terribly expensive. But let's talk about the regimen, going to the dentist at least twice a year, and then brushing. Do you need to go ahead.
Yeah, well, I think it's pretty simple. Toothbrushing with the toothpaste. The toothpaste should have fluoride because fluoride prevents decay. And then in addition to brushing, trying to clean in between the teeth. There's a lot of surface area between the teeth where bacteria collect. So using floss, or we now have these great little tools called interdental brushes or interdental cleaners. And they could be very small and they could fit in between the teeth. And those things are great to clean the teeth well. And again, I think if people do this every day and then see their dentist, they really will go a long way to preventing a lot of these problems.
Yeah, these tools, by the way, you're not talking about, first of all, you're not talking about spending an hour brushing your teeth. It's a couple of minutes. And a toothbrush, what's it, $1.99, maybe $3 now with inflation? It's not that expensive.
No, I think most people who have dexterity, who could hold a brush, could do well with just a simple, soft, bristle toothbrush. Of course, you have to use the right technique, and any dentist or hygienist could teach you how to do that if you don't know. Focusing on the gum line, that's where the bugs tend to congregate. The dental plaque forms around the teeth, the gum line of the teeth. So concentrating on that, and also very crucially, in between the teeth, because you really can't say your mouth is clean unless you clean not only the outer surfaces of the teeth, but in between the teeth as well.
Yeah, I always find cleaning my teeth, it's a cerebral time for me. I think about, while I've got the brushing technique down, right? I mean, I can think about in the 3 to 5 minutes it takes to do that, I can think about the day's tasks or the next day's tasks. It just seems kind of a peaceful time, but hey. Last question, what about getting your kids off to the right regimen? So it's not only important for adults, we're talking about younger children as well, getting them off to even if they have, like 5 teeth because they've lost a lot of their baby teeth, it's still important to get that hygiene right.
Yeah, well, I think it's also important to maybe make every day toothbrushing time for everybody, and show how important it is. Doing it with them and showing them how to do it makes it obvious to them to do it every day, make it a habit in their life, show how important it is. Most people really, we're all busy, we're all distracted by so many things, and brushing teeth is not exactly exciting. And so it takes quite a bit, I think, to convince people to take on the challenge of doing it properly every day. But I think once you get into it and you have, you know what your mouth feels like when it's clean, you don't really want to, not have a clean mouth. I think that's an important point. Establishing good habits will allow you to know when your mouth is not clean and to, go ahead and take care of it.
Well, Frank, as we're having this conversation, I'm thinking back to when I was a kid in the 70s. We had Tuffy the Tooth. I had the Tuffy the Tooth record. I don't know if you recall that. I think we're about the same age, but that was a big thing used in school to promote making sure that you took care of your teeth. And I always enjoyed listening to my little Tuffy the Tooth record. All right, I'm dating myself. Frank, it's always great to see you. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
My pleasure. Thank you.
And that wraps up this episode of BRNAM. Have a topic of interest, someone you think we should talk to? Drop us a line, and don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, so much more, and all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content? Then visit our website. We're back again tomorrow with another great edition of BRNAM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
Waiting here for you to take and drink of. But if you're tired,
Now is your opportunity to co-create content around any topic on the First Lifestyle and Wellness Network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.